Hi, I'm Dr. Val Fletcher, and we are at River Oaks Chiropractic Clinic, and we are your Fort Worth chiropractors. And I'm here with Clark. And Clark, I know Dr. White just worked on you a little bit.
Yep.
And he was telling me that your shoulder was still giving you some problems.
Yeah, my shoulder, obviously with the repetitive injuries from golf, it really had bothered me earlier this year, and I came in here and did some work on it, and it really helped me towards the end of the year stay where I was able to play, so I appreciate that. It always bothers me a little bit, obviously, and I think what you've done has really helped.
So do you notice decreased pain, range of motion? What is it that you've noticed the improvement?
More range of motion and much less pain. My range of motion is much better, so I'm able to get a little better turn on my backswing, and so that's really helped a lot.
So in the past, what we've done with Clark is we were working on not just his shoulder, but like you just said, show us your swing again.
So yeah, so a golf swing, you need to have a good deep turn, and if you have a restriction in your shoulder, it's hard to do that. So.
Right, so we were addressing the shoulder as well as when you see him swing and open up, we were working in the mid-back so that he could get that increased range of motion there as well.
That's right.
All right, so let me get you to stand right here. And I'm just going to get you to face the camera there so we can get everyone to see. I want you to turn your thumbs up, and I want you to bring your hands above your head all the way and see if they can touch. And back down.
See, I wasn't able to do that 6 months ago.
And is there any pain or tenderness when
There's
you're doing that right now?
There's still a slight discomfort when I do that.
Right in the front here.
Yeah, right.
And you can notice too that when he's bringing his arm up, it's actually coming forward as opposed to staying right at level with his ear over his shoulder when it comes up. All right, Clark, so I'm going to get you to sit here for me, please. So I'm just going to check, again, range of motion of the shoulder blade. Yeah, and it's binding up right there. And I can feel it in the AC joint, along in the pec, along the clavicle, the collarbone, and a little bit right under there in the shoulder blade as well, right?
That's right.
Okay, so let's get you onto your back then for me, please. I'm going to get you to slide down just a little bit towards your feet. And now this table moves up, so I'm going to bring it up a little bit. There we go. Yeah, right there, that rib is not moving, so I'm going to bring it towards me. I want you to take a deep breath in and breathe out all the way, all the way. Perfect. Okay, front rib as well. So the same rib in the back that was stuck is also jammed in the front, and that happens a lot, especially in more chronic injuries with the shoulder. So big breath and out. Good. Let's get you to roll over onto your side facing the door. And yes, if you heard my out, it is a Canadian accent. I trained up in Canada and moved down to Texas a few years ago. And I get called out on my accent all the time. All right, right there. I'm going to bring this down. So now what we're working on is loosening up the shoulder blade from the rib cage and increasing Clark's range of motion there so that he can get his arm above his head without having that muscle pulling it down and making it harder for him. One more big breath. And out. Very good. We're going to recheck that AC joint. Okay, let's get you to, I'm going to bring it back down. Sit up and facing the door again. We're going to recheck that range of motion. Good. Much better. Let's get you to stand facing the camera again. Same thing. Thumbs out to the side. Bringing your arms up. Much nicer. How's that feel to you now?
Yeah, much better. Straight up.
Perfect. Let's try your swing.
Yeah, so I'm able to get that rotation in there with the shoulder and get a little deeper shoulder turn.
Okay, let's get you one more time onto your stomach.
Okay.
I want to check those mid-thoracics. I know Dr. White worked on them, but there's one spot right there I could see that was binding up as you were rotating. So breathe in and out. Very good. That's better. All right, come on up and let's try that one more time.
Yeah, I can feel the difference in my mid-thoracic for sure.
Do it one more time facing the camera just so we can see that range. So you'll notice how his shoulder comes all the way back and this front shoulder now lines straight up with his nose. Well, thanks again for watching. We are your Fort Worth chiropractors. Please subscribe to our channel.